I have a story for you from Queen's Park now about wasted healthcare dollars. A City News examination shows that on one particular day last year, more than $1 million was wasted. That would translate into almost $500 million a year. I'm on Hospital Road, just steps from Queen's Park, and this is a problem the PC government inherited from the Liberals. It's been building for years. And City News has been digging into numbers provided by the PCs, and they show a small part of a massive budgetary problem that the Ford government is going to have to tackle.
I can assure you, we will find the efficiencies. Our platform, and I've been talking about our platform for the last couple months. Yeah, I was just going to shake your hand. Nice to meet you. I'm Doug Ford.
Doug Ford campaigned on finding efficiencies, and it makes sense his government will be looking at health care. It's the biggest cost in the budget. Ontario pays a whopping $58 billion a year for it, and it makes up 42%, almost half, of all of the province's program spending. One of the biggest challenges to the system is the lack of long-term care beds. There are 30,000 people on wait lists for them. It causes a ripple effect, contributing to a lack of hospital beds and hallway medicine, a problem City News has been documenting for years.
It was an absolute nightmare. He was completely ignored the entire time that he was there. Nobody was taking care of his hygiene needs.
According to the province, an acute care bed costs $1,400 a day. A long-term care bed is roughly $177 a day. The data shows on October 31st, there were 1,031 people in acute care beds who were waiting for long-term care beds. Now we can tell you just how much more that cost taxpayers. $1.3 million. Multiply that, and it would be $460 million a year, almost $500 million. We couldn't get an interview with Health Minister Christine Elliott, but recently she acknowledged the issue.
There is a problem with that in any given hospital. On any day, you might have between 15 to 25% of the inpatient beds are being occupied by alternate level of care patients.
Now, we received a statement from the Ministry of Health today about this story, and it started by them blaming the Liberals for this problem. And then it went on to say, in part, our government is also committed to adding 15,000 new long-term care spaces in 5 years. And as a first step, the government is moving forward with projects that will see more than 6,000 new spaces added across Ontario. So this is going to be a massive endeavor for the government. It's going to create these new spaces, but it also has to find $6 billion in efficiencies, and it's promised to balance the books by year 4. How they're going to do that, well, it's going to be interesting to see.